Dr. Joseph Kanu understands that one way we can honor God is by being as healthy as possible. Dr. Joe believes modern science proves the healing abilities of remedies found in Scripture, and as a practicing chiropractor, blends those biblical truths with cutting-edge technology to enrich his patients' lives physically, emotionally, and spiritually. Welcome to Simple Truths for Healthy Living with Dr. Joseph Kanu. Listen for the next 30 minutes as Dr. Joe shares tips to help you live the healthy life God intends for you. To be a part of the show, call 313-838-1035. That's 313-838-1035. And now your host, Dr. Joe.
This is Dr. Joseph Kanu broadcasting live from Rochester Chiropractic in downtown Rochester. And we have a special guest with us tonight, Dr. Haddad.
Good evening, everybody.
Yeah,
Happy to be here again.
Welcome. Thanks for coming in again. Now, you're going to commit. Can you commit to coming every Wednesday, Jeff? What do you think?
I think I can do it for you. I think I'm ready to make the commitment. Now we have a lot of fun. Each week we've been educating a lot of people and a lot of great feedback from patients who have listened and new patients who have found us. So it's been a great thing.
It is. I would like to start the show with a scripture reading, and that is this. It's from 1 Corinthians chapter 11, verse 23. I always found this to be an interesting one, and it's Paul talking about that we share in the Lord's Supper, right? So, for I received from the Lord, which I handed on to you, that the Lord Jesus, on the night he was handed over, took bread. After that, he had given thanks, broke it, and said, "This is my body that is for you. Do this in remembrance of me." And in the same way, he did it with the cup, saying, "This is the cup of the new covenant in my blood. Do this as often as you drink it in remembrance of me. For of the Lord until he comes." This is a wonderful thing that we're proclaiming his death and that he's coming again, right? And therefore, whoever eats of the bread, drinks the cup of the Lord unworthily, will have to answer for the body and blood of the Lord. So I thought, that really hit me, that some people who are drinking the cup, so when you share in the Lord's Supper, if you do it unworthily, or really don't, as Paul's saying in verse 28, a person should examine himself. And so when you eat the bread, drink the cup. For anyone who eats and drinks without discerning his own body eats and drinks judgment on himself. That is why many among you are ill and sick and are dying. And that is pretty heavy. So if we share in the supper, it brings physical destruction to us. That's why many of us are sick and ill and dying. And as physicians, Jeff, this is something we have to deal with. People and with ourselves as well, right?
I agree.
And so this show, what we like to try to do is talk about simple truths that enrich and prolong our lives, and we like to share information, the best that we know of, right? And information is always changing, and we're learning. And we would like to invite any callers to call in to the station, 313-838-1035. If you have any questions tonight, we'd like to keep the calls to dental problems.
Yeah.
Okay?
Yeah. Well, your scripture talked a lot about eating, and I know that what people don't realize, and we talked a little bit about this last week, when you don't have a healthy mouth, not only can you not eat the proper foods to help prolong your life and help your body, but what we're going to talk about tonight is how connected the mouth is to the rest of your body. For whatever reason, people don't think that an infection in your mouth affects the rest of your body, which is just the first thing from the truth. In fact, more and more research is showing how bacteria in the mouth is not only causing problems in the mouth, but is causing other problems with your heart, with diabetes, blood pressure, even some things as much as some different cancers, pancreatic cancers. So my goal always is to educate, as is yours. And what a lot of people don't realize is gum disease is happening. And, the stat out there is that 80% of the adult population have some form of gum disease. 80%.
80%.
And
so this really you're going way beyond just cosmetic dentistry, and if you got a cavity, drill it and fill it.
This is talking about overall systemic health, and it starts with the mouth. And, whether you are a person regular with dentists or not, unfortunately, the majority aren't. The 50% of people don't go to the dentist on a regular basis. And I know there are people out there listening right now that are thinking, well, I don't have any problems. Nothing's hurting. I'm fine. I hope that's true. But the truth is that when it's hurting, it's too late. And a lot of the things that are happening in the mouth, you could have an extremely large cavity in a tooth, and we could address it. But when it starts hurting, it's difficult to address it with a small conservative filling, not extractions or things we don't want to talk about.
Well, it's the same in our field with chiropractic. By the time you have back pain, it's pretty advanced. Oh, mm-hmm. Most cancers are like that. You could have breast cancer, prostate cancer. You could be ready to drop dead of a heart attack, not know it.
Yeah.
So, hey, if it ain't broke, don't fix it. That's nice for a car, but even for your cars, we change the oil, right? Before it's a problem. And dentistry for sure, brushing, flossing. And I love that you bring this way beyond just drill it and fill it, or let's have a whitening. Not that there's anything wrong with cosmetic.
No, absolutely.
But it goes far beyond. And this is our health, the portal of entry, our mouth.
A lot of dentists, and this isn't to put anybody down, because I think the great thing about dentistry is you can have any type of practice you want. When I got out of dental school, actually I take it back, when I was in dental school, I was visiting other offices, and I went to 20 different offices, and I can promise you not one of them was alike, which is pretty special, which means that a dentist can practice any way he wants to, and more importantly, a patient can find a dentist that they have a camaraderie with and share that philosophy. I just chose to not be a tooth mechanic. I didn't want to be that. I really want to consider myself more of a mouth doctor. And so I take the time to educate myself on a lot of things.
I love that.
Outside.
You're a mouth like you have a knee surgeon, heart doctors, back doctors.
There's just a lot of things that have that contribute to overall health in the oral cavity. And last week we talked about dental implants, and I love talking about them because it's just a great piece of technology that really changes people's lives. If you've lost a tooth or have maybe lost all your teeth and you have dentures that are not fitting and you're not the answer for you. And so, actually back to, talking about the website, if you are interested in hearing more about dental implants and maybe you missed last week's show, one of the cool things about the simpletruthsforhealthyliving.com is you can go to the listen to past shows and take the time to do that, because it was interesting for us to discuss things, and it's great when we can fix people's problems. But what I want to concentrate on tonight is maybe preventing those problems, preventing that tooth loss, because one of the big reasons people lose teeth is because of gum disease.
Gum disease, okay.
So that's
so about our past shows, Wednesday nights, you did one Tuesday night, but if you click on the Wednesday nights, those are the nights when Dr. Haddad gave his talks.
Yeah, and we cover a lot of good things, and we will cover a lot more.
So we were talking about, we kind of ended it with, you have these implants, and anchor the people who have dentures that can anchor it.
Yeah, I mean,
so that now they can chew better.
People who are living with dentures are just getting by. I have yet to meet a denture wearer who loves their dentures. Okay, they just it's a means to an end. They use them, they get by. But when we place a few dental implants to secure those dentures, even the person's present denture, down to their mouth.
So you can anchor their existing dentures.
And a lot of times we can. Sometimes a new denture is necessary. Again, each person's different, but
So that's wonderful. So now they can chew again, right? So digestion begins in the mouth. Most healthy nutritional food is live, raw fruits, vegetables, which requires a lot of mastication, right? A lot of chewing. So this is paramount for our health.
And it's
bland diet, the dead food diet, and which leads to so many other health issues.
All the processed foods, carbohydrates, they're very easy to eat, and so it leads you down the path of unhealthiness, really.
So you were saying, so the tooth, when we lose teeth, what's the main reason why we lose a tooth?
Well, one of the main reasons is periodontal disease or gum disease, and bacteria in your mouth, once it starts to flourish because you maybe aren't brushing and flossing as often as you are, or even if you are, I can't stress enough that how important a professional cleaning is. If you're not doing that regularly, bacteria starts to build up, the gum tissue becomes inflamed, bleeding occurs, and that bone starts to resorb away. You start to lose the bone. Correct.
How fast?
Very rapidly.
Very rapid.
If the teeth are there and that bone loss occurs, it wouldn't use the word rapid, but steady. And different people go at different rates depending on their overall health. What really is scary is when you lose that tooth. Now we're talking rapid bone loss. Just unfortunately...
It's just like osteoporosis, right? If you don't use it, you lose it.
Absolutely.
Or like swimming's great exercise, but it's not stressing the bone. So you need that... What you're saying is you need that tooth there stimulating and actually... irritating in a way the bone, so the bone builds up.
That's exactly it. And the nice thing about
challenging it,
right? Yeah. Having a structure there, obviously the tooth, or we talked about dental implants. Dental implants serve the exact same purpose. If you place a dental implant in the bone, it's not going anywhere. It treats that dental implant like a tooth. And so, unfortunately, any of our listeners out there, if you have teeth that you lost many years ago, even considered dental implants and maybe said, oh, well, that's an option for me maybe later on in life. It may not. If you wait too long, that bone may not be there for us, and you may take this opportunity and place yourself out of even being a candidate for a dental implant. It happens very quickly. So the main thing with gum disease, people out there who are again thinking, well, I don't have it, nothing's hurting, I'm fine. Ask yourself this: have you ever had any of your gums bleeding? Okay, bleeding gums are unhealthy gums. There's infection there. They should not bleed. Are you having? Do you have any old dental work that is breaking down and starting? Some of the older metals corroding into the gum tissue. That's another thing that really could push you down that road to having gum disease. Persistent bad breath, looser moving teeth. These are things that are. Yeah, absolutely. Again, there's a very, very big reason why going to the dentist regularly is important. Not only for your teeth, but the gum tissue, the bone surrounding it. Again, the overall mouth. Yeah. Having somebody taking a look at things, we can nip things in the bud where you would never even have a problem. But if it gets past that point, now the normal cleaning isn't appropriate for you, and you have to start getting into more in-depth cleanings, which take several visits, are a little bit more invasive. Unfortunately, sometimes you get to the point where that's not even enough. They've waited too long, and maybe even gum surgery is necessary, which we all want to avoid. We want to be conservative. So, do yourself the favor. If you haven't been to the dentist in a while, come on back. We're not going to judge you. Believe me, I promise you that your dentist has seen a lot worse than you. I guarantee. And everybody's, there's a lot of humility in maybe what they're going to find or what maybe the dentist is going to think. please forget about that, because that's not the way our brains work. We just want to help you. Again, we've seen a lot worse. I guarantee you that. And it's never too late. Don't wait till it's too late where we don't have as many options to offer you. To have choices is a great thing in life.
Yeah.
I'd love to say, Dr. Joe, we can do this, this, or this. What would you like to do? But if you wait too long and say, Dr. Joe, I can only do this for you. And it's not the most pleasant thing, but this is our only choice at this point. That's, unfortunate.
It might be a lot more expensive at that point.
A lot of times it is.
So you say, backing up, for our listeners who've just tuned in, we're listening to Dr. Jeffrey Haddad of Rochester Advanced Dentistry. And we're talking about periodontal disease. And you were saying over 80% of the population has periodontal
50% is the stat out there. Wow. Only 50% of people go.
Of the 50% that do go, I wonder how many. So you're saying people who do go, will still have this.
It can happen, and that's a good. I'm glad you brought that up. Unfortunately, we're just not unfortunately. We've all gotten smarter. That's fortunate, but unfortunately, what they've found is that most adults will come into some kind of form of periodontal disease, but it's very manageable. Again, if you're
when
being
you catch it early before it's a big showstopper.
I'll give you an example.
Okay.
For you've been to the dentist, you've been in your hygienist chair. Have you ever heard her calling out numbers as she's going around your teeth? Right. That's called periodontal probing. We're literally measuring the bone around each tooth. 2s and 3s are normal. That's good within. We don't like that. 4s with bleeding. These are signs of problems. 5s and 6s, these are bigger problems. And so if you're going regularly and we see a 4 here or there, or maybe a 5, we're able to treat that. And we can halt that, even maybe get it back up to a 3. Now, we're not going to be able to grow bone here. We can't.
Right.
Again, once it's gone, it's gone. But we can maintain it. Are you
using your laser for that?
Yes, we do. I mean, that is something that we use.
That's what I love, the laser that you have. That's pretty advanced.
It's the neat thing about the laser is, I think everybody in every industry, lasers are used for everything, and in dentistry they're used for a lot of things. I use them for many different aspects of dentistry. Treating gum disease is one of them. We put it on a very low level where it's just going down and disinfecting the pockets.
That's what I was wondering.
Yep,
that's
great. It works so. 5 years ago, we weren't using it. It wasn't as proven as it is now. And we see results that we could never have gotten before with the laser. It's just a great piece of technology that helps us.
Really get in there.
Yeah,
right?
and again, that energy, that getting down there and disinfecting is the key. We got to get the bacteria down to a level that you, with your oral hygiene, can maintain. And some people, again, if they haven't been to the dentist in a long time, now they're below that level that they can't take care of themselves anymore. They need their dentist to get them up to that par level, so they continue on with that help.
So then they can take care of it themselves.
You got it. It takes. Listen, we can't do it ourselves. We need your help as much as you need ours.
Sure.
It's a team effort here.
It's a team effort. But the good Lord did make us dependent on one another.
It's true.
We are dependent. Last show we were talking about spices, and our spices. Conclusion, really overwhelming. Research and science shows
good.
Kick it up a notch. Use your spice. Use cloves, cinnamon, garlic, ginger, thyme, rosemary. Use those spices, and they have a synergistic effect altogether. Now, one thing I like to do in the morning, especially this time of year when everybody's getting sick, besides the lemon and honey, fresh lemon, but mixing cinnamon, clove. Now, clove has some antiseptic, but also analgesic effect. Right?
Yeah, yes, it does.
You guys use clove oil?
We have, and some patients swear by it. So it's a great option.
So you put like a quarter teaspoon of cinnamon, a quarter teaspoon of clove in some water, mix it up. And I do a mouth rinse in the morning.
That's great.
Rinse the mouth, the gums, try to get it in there. Probably doesn't get in like the laser does.
But probably isn't as meticulous as you, and some good old fashioned Listerine will help people out. It's probably a lot easier for the people to get, but that's great.
Yeah.
I mean,
so like the Listerine kills the good bacteria, or antibiotics kills the good bacteria. A lot of drugs kill the good bacteria. Guess what? Cloves and cinnamon doesn't disturb the good flora in our stomach and in our mouth and your whole alimentary canal.
Yeah, no, it's a good point. And I'm just glad. I'm just excited about the good spices thing because I love my spicy foods, and unfortunately we have a rule at my house. My wife says that I have to spice after, so I have to unfortunately cook the food bland, and then I have to add my spice after because she is not a spicy eater.
You have to have her listen to yesterday's show.
I will make her do that.
Okay, now tell me, Doc, what are the causes of we always talk about what's the root cause. So you have periodontal disease is the bacteria that grows. Causes you to lose bone mass, causes you to lose your tooth.
Correct.
80% of us have it.
Correct.
Now, so like maybe rinsing with the cinnamon clove, that's good. And then you have to rinse that out of your teeth. But what causes those problems?
A few things. Again, neglect. If you're not taking care of things, if you're not doing the standard brushing 2 to 3 times a day, and for those of you out there who do that, it's great. For those of you who are the majority who don't floss, I know you don't want to hear this, but flossing is the key to avoiding any problems with your gums. I tell people always ask me, how important is flossing? And I make the joke of you can floss the teeth that you want to keep because that's really the truth. If you don't floss, there's a stat that I love. If you actually start flossing today, you will add 6 years onto your life.
Wow.
I mean, think about that.
That's a great stat.
It's an amazing thing. I mean, how hard is it to floss? And believe me, I don't want everybody to think that I'm some, flossing king here, okay? It's difficult for me for me to have gotten into that routine, but that's all it is. You get into a routine and it becomes the norm. It's a very easy thing, and that is about the best thing that you do to avoid gum disease. The other things that go against you, though, is old dental work. That's, again, it's not hurting you. But if it's breaking down the corrosive metals breaking down into the gum tissue, if things have changed or have fractured, your body's treating it like a foreign object. You could be the flossing king, Dr. Joe, but if you got a bad filling that's contoured the improper way, it'll treat it as if you've never flossed in that spot ever. So maintaining your dental work is a very, very important thing. And so those are a couple of things. There's some other things that go against you. Smokers. Obviously smoking isn't good for anybody. So many things. This is another one of them. Smoking, chewing tobacco are very, very big risk factors for periodontal disease.
Do you see many people chewing tobacco still?
I do. I really do. You do your best to educate them to quit. And some people just aren't going to. The best piece of advice I can give to anybody who's chewing tobacco is just please move it around. And it's not me advocating it, but at least if you're moving out of the same spot, you're decreasing that chance of any hyperplasia or changes in your gum tissue. So, no, it happens. And another thing that you kind of alluded to earlier is our medications. There are medications that will are dealing with this. They cause dry mouth. A lot of medications will reduce your saliva flow.
Okay.
If you have saliva flow that's reduced, everything's dry in there. Bacteria, plaque can stick to your teeth a lot easier. It can settle in your gums a lot easier. You don't have that flushing situation with the saliva. Saliva is a very important part to oral health. A very important part. So
saliva is keeping the bacteria from adhering to the tissue?
Correct.
Is that what you're saying?
It also keeps that balance between what you're talking about, which is the good and bad bacteria. It's keeping that a proper equilibrium there. So not having the proper saliva flow really goes against you. Some blood pressure drugs, anti-epilepsy drugs, steroids, things like that. There are a lot of drugs out there. So if you are concerned about this, or maybe you've been exhibiting some dry mouth, take a look on your bottle and see if that's one of the side effects, because
So the periodontal disease, what health problems does it give us? What are the health issues?
That is,
I always like the nuts and bolts.
No, and
I'm not as big of a cosmetic fan. I mean, it's nice to have a nice smile, but I'm really into what the real health issues.
I found this for you specifically. You're going to love this. I'm going to go through a few stats here that are amazing. Gum disease increases the risk of head and neck cancer. By the way, these are all documented by the Mayo Clinic, Harvard, some big institutions here. Tooth loss and gum disease increase the risk of Alzheimer's disease. That's a Mayo Clinic. Okay.
Alzheimer's. Wow.
Gum disease increases pancreatic and kidney cancer risk by 62%. Here's telling. Diabetes and bleeding gums increase your risk of premature death by 400 to 700%.
Wow.
I mean, think about that.
That is big.
I mean, it's an amazing thing. That bleeding gums, that's all we're talking about here, right? 93% of people with gum disease are, again, at risk for diabetes. Here's a good one. People with gum disease are twice as likely to die from heart disease and 3 times as likely to die from a stroke. I hope I'm scaring our listeners out there, because it really important. Is. It's been called the silent killer, and it is. And, this is one that we talked about, I think, briefly a couple weeks ago. Pregnant women with gum disease have only a 1 in 7 chance of giving birth to a healthy child of normal size. So this is affecting your body.
Can you repeat that one?
Pregnant women with gum disease have only 1 in 7 chance of giving birth to a healthy child of normal size. If you have any questions, please feel free to go to our website at rochesteradvancedentistry.com, or you can call our office at 248-656-2020. We take this very seriously, and again, we welcome any people who have been away from the dentist too long back. We're here to help you.
Yes, and I really would like to encourage all the listeners, if you have any amalgam fillings, please develop a plan to get those out. Take your mouth seriously, because that is the portal of entry of so many diseases, as we've heard Dr. Haddad say today. Dr. Haddad, thank you so much for coming.
Thank you.
You can listen to his shows, too, on our website, simpletruthsforhealthyliving.com. He's mainly on Wednesdays and is committing to joining us on every Wednesday to talk about that.
I will be
dental health care, and I really appreciate it. And remember that when all that we glory of God, have a wonderful evening, and we'll talk to you tomorrow night.
You've been listening to Simple Truths for Healthy Living with Dr. Joseph Kanu. If you'd like to talk with Dr. Joe, call 248-656-1011. That's 248-656-1011. And tune in again Monday through Friday from 10:30 to 11 for another edition of Simple Truths for Healthy Living with Dr. Joseph Kanu.
The content on this program is for sharing general information purposes only. It is subject to change with ongoing research. It is not meant to diagnose, treat, prevent, or cure anything. Dr. Kanu encourages you to make your own healthcare decisions based upon your own research and in partnership with a qualified healthcare professional of your choice.